Dr. Chelsea Clinton, happy to have you here today. So, about that glass ceiling, I thought I would start with a list of countries that have had a female head of state. I'll start with Europe, the UK, Germany, Italy, Finland, Sweden. I'll go to Asia, India, Pakistan, South Korea, Taiwan, North America, Canada, Mexico. Even if you look back to 1969, Israel had gold in my ear. Why haven't we been able to break the glass ceiling, and what do you think it's going to take in the United States of America?
Well, Mark, I'll answer your question, but first I want to thank you for inviting me here today. I want to thank everyone at Upfront. Having been backstage at many of these events, I know they go most seamlessly when there are so many people working in kind of coordination and symphony to ensure that that happens. And I also want to thank everyone here at Intuit Dome, who certainly, for me, has kept me well hydrated and well caffeinated. The list of countries that you included, are largely parliamentary systems. And so I do think there is a difference when people kind of rise to the top of their party and then the party is elected. We have quite a bit of data here from the United States that in kind of head-to-head contests, whether for a promotion or an election, when citizens, voters in this instance, look at kind of two identical resumes and kind of, cascades of accomplishment, they're still more likely to pick like Andy than Ann. If we look at even voter sentiment data from last year, 10% of women said they were still uncomfortable voting for a woman. And so when you're starting with not only kind of an electoral system that makes it harder because of kind of a long history of not only kind of sexism, but kind of the norms of kind of how we think of leadership, but also kind of you have to work that much harder because the total available pool of voters who'll even consider you is just bluntly smaller than that of a man. And then we have, the related and aggravating factors of how often, the political coverage around a woman running for office, whether kind of for presidency, because we haven't yet had a woman president, or in the kind of half of states that have never elected a woman governor.
I guess you get asked a lot more about outfits when you're...
You get asked, right, exactly. So you only, there's a certain amount of ink.
What do you think it's going to take to break through that? Because I think it would be a great accomplishment for our country.
Well, I think that we have to continue to ensure that any of us who care about our country, women or men, are asking ourselves and asking one another, would you consider running for public office? If you were not happy about how the fires were dealt with here, what are you going to do about it? Are you going to think about running for office, whether at the county level or your local city level? Are you going to think about volunteering to be one of the various public and private commissions that the city or the county or the state have impaneled in the last month and a half? I hope, particularly, in spaces and places, including this one, where I might be the only person to talk about politics, that each of us who cares about our country, who cares about the future of our country, or maybe are more hyper locally focused here in Los Angeles or wherever we may call home, are thinking about, would I run for office? Because it shouldn't just be a question asked of people whose last name is Clinton. Right? I mean, people have asked me if I was going to run for public office for truly as long as I can remember. One of my earliest memories...
It wasn't on my list.
I was 3 years old. I was standing on the side of a campaign rally in Arkansas. I was handing out stickers and American flags because that's what you can do when you're 3 years old and your parent is running for public office. And I think I was in Magnolia, Arkansas. And this woman came up to me and was like, "Oh, Chelsea, are you going to run for governor of Arkansas one day?" And I was like, "I'm 3." Right? But I share that not jokingly, but hopefully in the sense of we should be asking young people and old people. We should be asking, our family members, our colleagues, people that we are in community with, that we respect, that we have a similar view, whatever that view may be of the future. Are you thinking about running for office? And then recognizing in a kind of blasé or naive way that it is harder for women.
But
we shouldn't be dissuaded.
Leaving aside politics, 58% of bachelor degrees are women. 67% of master's degrees are women. If I look at leadership overall, 26% of Senate, 29% of House seats, 28% of governors, 8% of S&P 500 are run by women. So if I look at that, like, why is female representation important overall, and how do we begin to change the ratio?
Well, I think, it always matters who's around the table when decisions are being made. And we certainly, this may not be what is popular in the zeitgeist of this moment, but we do have quite a bit of evidence that here in the United States, diversity is a strength, and that diverse teams in general do make better decisions, and that gender, if we're kind of centering men, then by definition is included in kind of the framing of diversity. And we also have lots of evidence that women, particularly in elected office, have longer time horizons than men. That not only, in the countries that you mentioned, but also, in Latin America, in Africa, and other parts of the world where there have been women elected as the kind of head of government or the head of state, or in kind of parliamentary or congressional systems, that women are in general more likely to make longer term investments, not only in health and education, which are often more kind of feminine coded areas, but also in areas of kind of research development and defense. And so I think that we're stronger when we're all included and all given an opportunity and all listened to. And I think that too often, though, in conversations like this, we focus only on like the recent delta, where we have a real recency bias. So for example, in 2018, we had an unprecedented number of women running for Congress, and we were still fewer than a third of people running for Congress. There's a sense of like, this is unparalleled. And you're like, awesome, let's not mistake progress for success. Or when women like breached like 10% of Fortune 500 company CEOs, and they're like, that's great. That was close to a handful of years ago. We're now at 10.4%. So I think, marking and understanding progress and what has facilitated us to kind of reach certain milestones is important, but to not mistake that for real equality.
And I mostly ask you about women's issues, both because I know you're an advocate for that, and because I know that at Metrodora you are doing investments in that. But I want to take one more second before we talk about venture capital to ask you about Dobbs. Women's rights, are we moving backwards? You produced a film about women's access to healthcare in the state of Texas. Could you talk a little bit about that and where you think we are as a country?
Well, one of the other commonalities in the list of countries that you enumerated that had or currently have women as head of government is that they all have paid family leave for pregnant and new moms. Most have stronger workplace protections for women than we have here in the United States. Most already have settled law and regulation around abortion. So there's actually quite a wide spectrum in the countries you listed. Some abortion is completely legal at the discretion of a woman up to 12 weeks, and then after with clear medical exceptions. Some it's kind of legal at a much kind of longer time horizon. And so I do think I can't answer kind of this question about Dobbs with also not like referencing back to your first question, because of course I also like candidly believe that one of the challenges for women running for elected office here is that we're constantly having to talk about our reproductive organs and the ability to determine our fertility as a fundamental human right. So when you ask about Dobbs and the film, thank you for mentioning Zarowski v. Texas that my mom and I produced, it follows the first plaintiffs to sue for being denied medically indicated abortion care since the fall of Dobbs. So really in more than 50 years. All women in Texas, all women who had desperately wanted pregnancies, all women at some point in their first or early second trimesters, received devastating news that their pregnancies were non-viable, and in some instances that their lives would be at risk. And it follows the stories of the women as they then confront kind of what to do about that. Some women leave the state, some women hold out hope. Amanda Zarowski, the name lead plaintiff, actually went into preterm labor at 17 weeks, and her doctors told her she couldn't safely leave the state. She had to stay. She was forced to be into sepsis for 3 days, where they finally felt like her life was at risk, because currently the medical exceptions in Texas are written in such purposefully, I would submit, contorted way, with a penalty of 99 years in prison for doctors who perform an abortion without real clarity around, again, the kind of purposefully opaque medical exceptions, that what has happened is so many women are pushed to the brink of death. And so we really felt like we wanted to honor the extraordinary courage of Amanda Zarowski, and then ultimately the more than 20 women who joined the suit to help share their story. And we also bluntly hoped that with more attention, that there would be kind of more affirmative pressure on the Texas State Supreme Court to finally determine that there needed to be clear medical exceptions. That didn't happen. A report came out last week that sepsis infections have increased more than 50% in pregnant women in Texas, that at least 2 women have died because they were denied medical care that they desperately needed. There are multiple more women who have suffered catastrophic kidney failure, brain damage, loss of fertility, and other life-altering medical consequences because they didn't get the health care they needed. So certainly, I know my mom and I are continually committed to help Amanda, who really now, she was named a Time Woman of the Year, is very forward and traveling to other states now, including Arkansas, my original home state, to stand in kind of solidarity and community with other women who have suffered as she has, but also so that we don't look away.
And it's streaming, right? Where can people watch it?
It's streaming on Jolt. And I really hope, candidly, that
streaming on what?
On Jolt. It's a new platform. I don't know. It's like we're like the first
Jolt?
film, Jolt.
Okay. Can we buy it on Amazon Prime or something?
So it's a good question. We were willing to give it away, and we couldn't get any of the streamers to take it because it felt too political.
So to the people with Upfront Summit, if someone could write this down, let's send a link to the whole group so that everyone knows where to find it on Jolt. And hopefully lots of people watch it. I want to make sure we talk about Metrodora. What was your reason for getting into venture capital? How did you get started? What is the focus of the fund?
So after the admittedly 2016 election, which was probably the catalyst for your first question, and I very much acknowledge, I was surprised by how often I did meet people around the country who would say to me, I really can't vote for a woman. And so after the election, I just thought, well, whatever I'm doing to support women, it wasn't enough, or whatever I'm doing to support men and women who are trying to kind of support and champion kind of our health and well-being, yes, but also our lives and our agency and our full potential. I need to be doing more. And so I first got involved in a couple of venture-backed companies in the women's health space, and then got involved in really mentoring and supporting kind of women founders who were working outside of women's health, because I think we do a great disservice to women if we don't acknowledge that we are perceived differently by internal and external constituents. I think that is not helpful. And so really trying to help women be mindful of the different ways in which we're perceived, so that hopefully we can ameliorate that and kind of more than kind of supersede whatever implicit or explicit biases may pervade around how we kind of move and act and work and build in the world. And then fast forward a few years later, I'd done a lot of work with Metrodora Ventures, and Andy and Fred had said, we think you should make this more of kind of a focus of what you do. I said, thank you. I know a lot about a lot. I know nothing about starting or running a venture fund. And they thankfully introduced me to my wonderful partner, Caroline Cassie, who did know a lot about starting and running a venture fund. And we were able to spend about 6 months together before the world shut down with COVID, really kind of delineating what each of us would do, defining what we hope to do, kind of aligning on our kind of ambition, values,
talk about what
mission.
Caroline does versus what you do. Do you guys make decisions together? Does she focus on one part of the business, you focus on others?
We make all our decisions together. We support all our portfolio companies together. I was at the Children's Hospital of LA yesterday, actually, with one of our portfolio companies CEOs, talking about kind of how we can take what they're doing to hopefully really deploy it for better specialty matching in pediatrics, because we massively underinvest in pediatrics. Back even in the halcyon days of like 5 weeks and 3 days ago, where we had a fully funded NIH, we massively underinvested kind of federal research dollars in basic and applied science in pediatrics. And certainly if we look at kind of the landscape on a kind of pro rata basis, we also massively underinvest in kind of venture and growth capital in pediatrics. So constantly trying to crowd kind of, good and great people doing good and impactful and scalable, sustainable things into pediatrics. So like was so happy to be doing that. Caroline's still a recovering lawyer, so she spends more time kind of on some of the nuts and bolts.
Super early stage, or are you stage agnostic?
Pre-seed and seed, very early stage. Really care about why someone's doing something. Of course, kind of what they're doing and how they're doing it. I care a lot about people having at least what I think of as the right blend of confidence and humility, like the confidence that they're the right person to do this, but also the humility to know they can't do it alone. And to be able to ask kind of for advice and guidance and help and partnership as soon as they think they might need it, instead of waiting until they have to have it.
Right. Is it like 20% healthcare, 40%, 50%? Like what's the balance for you of those type of investments, and how important is technology versus not technology?
Certainly we've only looked at tech-enabled solutions, although would be happy. I don't even think anything's really non-tech enabled these days, as I was kind of stumbling around in my brain. And we look at anything in kind of what we think of as health and learning, and we define learning as anything that kind of facilitates or disintermediates the delivery of kind of knowledge or skills or information, from our earliest learners to our lifelong learners, kind of in school settings or workplace settings, or kind of the third place of kind of continuing to develop our brains and capabilities. And we're more than 2/3 healthcare, but that's just really a reflection of what we've been most excited about and had the most conviction around.
Did you raise money from outside LPs?
We raised money from outside LPs. So we have raised 2 funds, and it's exciting and invigorating and stressful and all the good things in life.
When will you raise the next fund, and have you thought about how much you're going to raise?
I think we'll raise the next fund starting next year. I hope we're able to raise 50. Would be happy to talk to anyone in this room would want to talk to me.
Okay.
Yeah.
Great. Talking about healthcare, U.S. healthcare, $5 trillion, approximately 17.5% of GDP. We rank almost last in OECD countries in life expectancy, infant mortality, preventable deaths. What's wrong with our healthcare system? And you can't solve it all. Do you know which parts of it you want to make a biggest impact?
Well, I think we have to acknowledge we don't really have a system, right? And so kind of conceptualizing it in a unitary way, I think, is understandable, but also not accurate. If we look, though, at the OECD countries, we are the only country to not, in that cohort, to not have kind of a more robust insurance system. We also know that so much of what determines someone's health and well-being happens outside of healthcare. We also have a much higher rate of unhoused people. We have a much higher rate of both mortality and morbidity, so death and injury by firearms. We have a much higher rate of substance use disorder and addiction. We have a greater lag time kind of for a diagnosis in so many areas of metabolic health. So there are many reasons in the healthcare landscape, to try to not use the word system, but also many reasons exogenous to it. And I certainly don't think that the likely outcome of the framework bill that the House Republicans passed late last night to pay for $4.5 trillion of tax cuts by cutting close to $2 trillion out of the federal budget over the next 10 years, which will, by definition, have to include cuts to Medicaid or Medicare, are likely to make us healthier or to actually make our system lower cost. Because it's not going to lead to people needing less care. It's just going to continue to push people kind of into the highest acuity and nodes of care, largely our emergency rooms.
On the healthcare side, I'll just do a tiny plug before I ask my next question. We do about 22% of our investments in healthcare. We think it's really important. Kevin Zhang, who's here today, leads our practice there. My father was a pediatrician, so I'm very interested. I funded a company called Nanit, which is a baby monitor designed to try and use computer vision to have better outcomes for infants and as people grow in their young ages. Rula, which is a mental health platform trying to use telemedicine to bring more mental health across the country. So we certainly share your passion. On education, I'd say it's another area where we have very high spend in the United States. We have pretty unimpressive outcomes relative to other advanced countries. Where do you see yourself playing in the education space?
Well, if you're talking about education just kind of in the K through 12 area, which is where we certainly lag other countries and also lag ourselves as to where we were a generation ago. I think, let me back up. When I went to public school as a little kid in Little Rock, Arkansas, I went to Hall High for kindergarten because Little Rock School District had grown so quickly that the only schools that had capacity for kindergarten classes were high schools. And then I went to one elementary school and then went to another elementary school because I was being rezoned. But I had extraordinary teachers, and I also had extraordinary public health in elementary school. We had Nifty Nutrition, who came to teach us about healthy nutrition. We had the dentist, who I don't think his name was actually the dentist who came to talk to us about like good oral hygiene. We received our mandatory childhood vaccinations if we needed them in school. We had hearing tests, we had vision tests. We used to treat our public schools as the real engines of kind of supporting kids, like health, wellness, and potential. Teacher salaries have not kept up with the cost of inflation. In fact, in many places, not only have they not caught up with the cost of inflation, they've been cut back. We have massively disinvested for not only public health programming, but for sports and like broader artistic opportunities for kids in schools. I'm a big believer in like sometimes you need new things and sometimes we actually just have to remember what works. So if we actually paid teachers well, we actually gave dignity to their profession, we actually respected teachers to teach and had enough school nurses and school psychologists and school counselors and art teachers in the way that we had actually like not that long ago, like in my lifetime in Arkansas, which is one of the poorest states in the country, I think that we would see much better scholastic outcomes, academic outcomes, and much better health outcomes.
I have to ask you an important question. Okay. I know you have a 10-year-old daughter. I do. Is she a Taylor Swift fan? Or more importantly, is she a Philadelphia Eagles fan?
Are you asking this question because you secretly want to know if she like betrayed my husband's Philadelphia heritage and adopted the Chiefs because
I just
Taylor
noticed that maybe the Eagles kicked their ass in the Super Bowl.
No, she is a big Taylor Swift fan. We went to 2 Taylor Swift concerts on the tour. I actually, in a hopefully loving way, dragooned my parents to come to the second one we went to because I said, I don't think you can understand kind of the culture of our moment if you don't kind of witness the extraordinary achievement that was the Eras Tour, but also its spectacle. But she's a real Eagles fan too, because it would not be acceptable to my husband for any other outcome. But don't just ask about my daughter, like ask about my sons. Like they're also Taylor Swift fans and Eagles fans. Yes.
Okay.
Yes.
I didn't know boys were Taylor Swift fans, but that's just my gender bias.
Well, I have to say it's more about their big sister, because in the hierarchy of our family, like my daughter's the most important
So
person.
I don't get in trouble, but I want to ask you for a brief answer to this, which is from my father, I learned about the importance of turning up at life's most important moments. From my mother, I learned about persistence. You don't ask, you don't get. In a 60-second or less answer, what are some bullet points you learned from your father and from your mother that carry with you today?
So I'm going to answer that by talking about my grandmothers. So my mother's mother, I was incredibly close to. She had a life I couldn't imagine. She was born to unwed teenage parents. She had to start to work to support herself before she turned 13. Like, she had no model of love in her life, and then created an extraordinary, loving home for my mom and her two brothers. And she was born before women could vote in our country, and she lived long enough to vote for her daughter for president. And regardless of anyone's political views, I think that's a really powerful story of America. And she always told me, life's not about what happens to you, it's about what you do with what happens to you. My dad's mom also had a story I couldn't imagine. She was pregnant. Her husband was a traveling salesman. His car crashed. He fell face down in a puddle. If he had wound up face up, he probably would have survived. He drowned. She was 6 months pregnant. So my father grew up without his father. She then had to put herself through nursing school so she could support her son as a single mom in the post-war South. She said, though, she was always aware there were people less fortunate, and she was always aware of her blessings, and that she said, some people count sheep at night, and I count my blessings. She's like, and I think life is really about trying to expand your circle of blessings in whatever ways you can. She also said to me that she really believed in the ministry of showing up, which I really appreciated as well. She also told me we never light ourselves on fire to keep someone warm, which I also appreciate.
I love the first two. I have to think about this at last. But how about a big, warm welcome and thank you to
Thank you
Dr.
so much.
Chelsea
Thank you.
Clinton. Thank you.